All right. Good morning, everybody. And today I'm going to be talking about a project that is ongoing that I presented for the GIN about a year and a half ago. But the topic is family psychosocial risk screening in cerebral palsy. And this is going to be focused on engaging our stakeholders, our parent stakeholders, in adapting the psychosocial assessment tool, or the PAT. So for those who aren't familiar, cerebral palsy is the most common motor childhood disability, and it impacts approximately 1 in 345 children in the U.S. We know that rates of CP are higher for children who are born preterm, low birth weight, and also babies who are born in multiples, such as twins and triplets. CP is a group of disorders, and it's caused by damage or abnormal development in certain parts of the brain that control movement. And so this can happen before, during, or shortly after birth, or within the first few years of life while the brain's still developing. We know that CP can affect muscle tone, movement, and coordination. It can result in differences in sensory, communication, and adaptive and intellectual functioning. However, we also know that it can impact psychosocial challenges for kids and families. And so we know that kids with CP have increased emotional, behavioral, and developmental difficulties compared to youth without CP. And that CP doesn't just impact the children themselves, but it also impacts all of their family members. So parents of kids with cerebral palsy experience detrimental mental health and health outcomes themselves. Excuse me. So for parents, we know that they experience worse depression, anxiety, as well as poorer quality of life and sleep difficulties. And this is compared to parents of children without a child with CP. And while many families are resilient to these challenges across time, all families experience some distress and difficulties and would benefit from psychosocial support to help reduce the burden and overall improve their quality of life for all of the family members. So currently, we know that the psychosocial needs of families of youth with cerebral palsy are not systematically assessed. However, if we had a process in place to systematically assess for these needs, we could screen all of our families in an effective and inclusive manner. Systematically identify those families who are most in need of supports and resources, and then appropriately allocate those supports and resources to our families. And so that's what led me to my project. This is a project that's focused on adapting the psychosocial assessment tool. So for those who aren't familiar, the PAT is a brief caregiver report screener of family psychosocial risk. It really truly does assess the entire family, from the child themselves to siblings to parents and other caregivers in the home. And it assesses stressors as well as resources within the family. And then it characterizes families in this tri-level classification that you can see on the screen in this pyramid, with most of our families falling on the bottom in this universal category, and then a smaller portion of our families who need more supports and resources in the clinical treatment area. And so for this study, our aim was to incorporate the voices of our family stakeholders in the adaptation process of the psychosocial assessment tool for cerebral palsy, also being called the PAT-CP. So for this project, we recruited caregivers of youth with cerebral palsy who were between the ages of 0 and 21 and were English speaking. And then we asked them to participate in a semi-structured qualitative interview after they completed the PAT themselves. And so broadly, we asked them to talk about their psychosocial stressors as well as coping strategies. Then we asked them to provide feedback on the PAT-CP. So did they understand it? Was it acceptable to them? How relevant were the items of the PAT to your family? Was it culturally sensitive? And could you see this being a tool that would help you and your family in the future? And then we took those interviews and we conducted content analyses where we were extracting the data from the interviews and teasing apart the feedback that the caregivers gave us. Here's just some demographics of our sample. So it was a primarily mother female sample. 23 of our 24 families were mothers. It was also a primarily non-Hispanic white sample. However, this does seem to be representative of our clinic population. So we also have some child demographics. So for about our sample was about 50-50 or 60-40 split with more males, and again primarily non-Hispanic white for our children as well. We did try to get captured children from across different age ranges, as well as in the bottom of the table here, you can see the GMFCS score, which is a measure of their gross motor functioning. So 1 being the less severe and 5 being the most severe. So we tried to capture children across all 5 of those levels. So moving into some of our results. So the first theme that we found in our qualitative analyses were that caregivers really voiced positive feedback regarding the PAT-CP and viewed it as a really helpful clinical tool. So they said things like, this is really useful and it's really good and you can screen parents. Sometimes I'm in tears and I don't know where to start, and this is just a way for somebody else to check up on me. It could be a good way for people to let me know, or let people know what is going on for me without saying it. So if a parent's embarrassed about something, they can share it via the questionnaire. And they also felt that it was a good way to connect people with supports or programs that are available. And I like this comment. It opens the doors and helps to lead them in a direction to find more supports and resources. And then this last quote, that it was the hardest for us was right after diagnosis and the year following. And so this would have been a really nice tool to have. And then, finding different times throughout our child's life where we could be completing this to update the team. The second theme was that our parents liked the brevity of the PAT, but they felt that it really did comprehensively assess a range of psychosocial issues for the entire family. It was good, it was easy, and it was quick. But it did get to what we needed to talk about. It's comprehensive, and it really captures different ways that CP can affect different families, especially the sibling dynamics. A lot of our families talked about siblings because if you remember from the first couple slides, I talked about that CP is more likely to affect children who are born in multiples. And really, this family just said I liked the whole survey, and I was able to talk about my concerns and say more about the things that are a challenge for my child and family. And then the last theme that we looked at was some of the areas that our caregivers suggested that we add more questions. So talking about some community level stressors. So things like accessing public spaces, things like doctor's office and therapy offices, talking about adding questions about who's in the family support system. A lot of our families talked about the school system being a huge support for families, and that they just work really closely with the parents and the schools, and that the parents felt that the schools really understood the challenges that families experienced. And then lastly, parents were talking about kind of future worries for their families. So where will my child go in the future? Will they stay in our home? Will they move to a residential care facility? And so expressing interest in adding some concerns about what the future might look for their child. So overall, we found that our families thought that the PAT was an acceptable and useful screening tool to measure family psychosocial risk in pediatric cerebral palsy, and our families did highlight some novel areas for us to add questions and to assess on the PAT-CP. And to date, we have incorporated our caregiver feedback into the PAT-CP, and we are getting ready to start collecting data to validate this adapted questionnaire within our larger cerebral palsy population here at Nemours Children's Hospital in Delaware. And just wanted to say thank you to my mentors, so Ann Kazak and Wade Schrader, and this was all funded by a Nemours Biomedical Research Grant. This grant is ongoing until the end of the year. And yeah, questions.